Hello, my name is Vincent Dubois. I'm an ophthalmologist or eye surgeon who specialises in cataract surgery in the northwest of England. I work out of private practice locations based in Southport, the Wirral and Chester. Today I'm talking about immediately sequential bilateral cataract surgery, which is the fancy industry term for saying a situation where you have both eyes operated on for cataract during one admission to hospital, so on the same day. So why is this relevant? Well, 2/3 of patients with cataracts end up having both eyes operated on within a 12-month period. So is there any reason why we can't do both eyes on the same day? Or is there a reason why we should not do both eyes on the same day? There are advantages and disadvantages to both options. Far more commonly, there's a period of several weeks or months between the two eye operations, but this is typically a resource-based issue. And we would often leave several week period of healing in between surgeries because of historical reasons, such as slow recovery rates. As technology's improved, we've decided to shorten the period between the two eye operations so that many people operate on the second operation within a couple of weeks, a day, or just a few minutes. And when it's just a few minutes in between the operations, we call it ISBCS, or immediately sequential bilateral cataract surgery. So there are advantages and disadvantages to this. Many advantages include the recovery period. So you can imagine that if you have both eyes operated on during the same day admission, then you only recover for 1 3 or 4 week period rather than two lots of a 3 or 4 week period recovery. This means that there are also logistical advantages. So if you have to take time off work, you only take one period off instead of two. If you require someone to take you to your operation and back home afterwards, then you only need to bother your neighbor or relative once instead of twice. And also, we ask you to wait a minimum of 4 weeks before adjusting any spectacles after surgery. So if you have surgery in the second eye, maybe 4 weeks after the first, you might go 8 weeks before adjusting your glasses, whereas if you have both eyes operated on during the same day admission, you only have to wait 4 weeks. So really, there are many advantages for having both eyes done on the same day. And in one of my private practice locations, I think half of my patients have both eyes operated on the same day. There is an advantage if you have a premium lens implant as well. So these are lenses that aim to reduce your spectacle wear, as they can take a little bit of adjusting. And so if you have both eyes operated on during the same day admission, then that adjustment period is facilitated. In terms of disadvantages, there are many reasons why you cannot have surgery done on both eyes on the same day. These will often be medical reasons, and the commonest reason will be diabetes due to your slight increased risk of infection. Some patients just won't feel comfortable with the idea because they think it's both eggs in one basket, and they would rather do one eye at a time and see how each one recovers. If you have a delayed recovery, you can imagine that you might be blurry or gritty in both eyes if you have them both done on the same day, and that can be quite disconcerting. If your surgeon feels that you're at risk of a delayed recovery, either before or during the surgery, then you won't have both eyes done on the same day. And this is either planned before the surgery, or on the day of surgery, your surgeon will say, look, we're not doing the other eye today, we'll come back and do it in a couple of weeks. So really, if you're having both eyes done on the same day, it's because you have almost no additional risks or are very low risk from cataract surgery altogether. And it's generally done in your best interest with an enhanced recovery at its heart.